Scoliosis is a complex condition that affects the spine and can lead to severe discomfort and even disability if left untreated. Chiropractors play a crucial role in helping patients manage scoliosis and improve their quality of life. This video provides a comprehensive overview of scoliosis from a chiropractic perspective, including its causes, symptoms, and treatments. So what is scoliosis? Well, scoliosis is a condition in which the spine curves abnormally to the side, causing the spine to resemble the shape of the letter S or C. This curvature can occur in the thoracic upper region of the spine, the lumbar or lower region, or both. And the severity of the curve can vary, ranging from mild to severe. Now, what causes scoliosis? Well, the exact cause of scoliosis is unknown, but there are several factors that are believed to be contributors to its development, including number one, idiopathic scoliosis. Now, this is the most common type of scoliosis and is believed to be caused by a genetic predisposition. Two is neurogenic scoliosis. This type of scoliosis is caused by problems with the nervous system, such as cerebral palsy or spina bifida or a spinal cord injury. And number three, degenerative scoliosis. This type of scoliosis occurs in older individuals and is caused by degeneration of the spine due to aging or other factors. And four, congenital scoliosis. This type of scoliosis is present at birth and is caused by abnormal development of the spine. Now, symptoms of scoliosis can be wide-ranging. Scoliosis can cause a number of symptoms, including uneven shoulders. One shoulder may be higher than the other, or one shoulder blade may be more pronounced than the other. Uneven waist. The waist may appear uneven, with one hip appearing higher than the other, or one hip more forward or backward than the other. Back pain. Scoliosis can cause discomfort or pain in the back, especially in the affected area of the spine. Also, decreased mobility. Severe scoliosis can limit a person's ability to move freely and perform certain physical activities. Diagnosing scoliosis can be done by your nurse, a chiropractor. Scoliosis physical exam and assessing the patient's posture and spinal alignment are important. X-rays or other imaging tests may also be used to help diagnose scoliosis and determine the severity of the curvature. Treatment for scoliosis. I had severe scoliosis as a child, so for me, I did chiropractic. That was very helpful in managing scoliosis and providing a range of treatments, including chiropractic adjustments. So chiropractic adjustments can help improve spinal alignment and reduce discomfort or pain caused by scoliosis. Exercise and physical therapy are excellent as well. A chiropractor that can recommend Schroth exercises and physical therapy can really help to strengthen the muscles supporting the spine and improve flexibility. Bracing in some cases may be recommended or needed to help slow the progression of the curve and reduce the pain. And massage therapy. Massage therapy can help improve circulation, reduce discomfort in the affected area of the spine. Nutrition therapy. A chiropractor may also recommend dietary changes or nutritional supplements to help support the overall health of the spine. If you need help managing your case of scoliosis, contact Synergy Wellness, Chiropractic and Physical Therapy at this number right below or book online. And thanks for tuning in, folks.